So menopause hormone therapy essentially refers to the replacement of hormones after cessation of your periods, after your menses. And that refers to essentially the definition of menopause is 1 year after your last period. But any time at around that time, when we start to replace hormones, is menopause hormone therapy. So that's the Women's Health Initiative study, which was completed early in 2002 because of what they saw as the adverse outcomes with regards to breast cancer and ischemic heart disease. And so women went from, I think the statistic that I've found is 25% of women at that time were on hormone replacement therapy, and it dropped down to about 10% after that. There was huge media coverage about the study. I'm not sure this is actually correct. And what they actually went back and looked at is that it was only looking at women from 60 and above. Well, women from 60 and above have an increased risk of heart disease and breast cancer, irrespective of whether or not they're on hormone replacement therapy. And so now we've gone, oh, actually, yes, there are aspects of that we need to look at. And I'll talk about that through the podcast. But essentially, it was hugely alarmist and vastly overstated. And as you've just said, we still haven't gone back to the same level of uptake and education around hormone therapy that we did have prior to the 2002 study. So still only 13% of women have hormone replacement therapy for the reasons that you validly had.
That's super interesting. I'm wondering if you could also explain, there seems to be, so now that I am having conversations about menopause with, women I trust, and I'm curious to see what their experience was. Firstly, I started taking hormones well after my menopause, so maybe 3 years after.
Yeah.
And the reason I decided to take it is my doctor, who had me on DHEA and regenerative medicine. So I take metformin, I take DHEA, NMN, all those kind of anti-aging regenerative medicine supplements. She said to me that if I really want to have that improved skin quality and firmness, and also I am prone to pre-osteoporosis, so osteopenia, I think it's called.
Osteopenia. Yeah.
So she tested me for that, and I take vitamin D injections as well as supplements. She said the best thing you can do is start taking hormones, because you're going to see a really great improvement in it. So why don't you just take it for that? Because the hot flashes had stopped for me. My sleep was fine. The mood was fine. And the DHEA seemed to kind of do its thing, and I was feeling good. But I felt amazing once I started.
Yeah. And look at your skin. I mean, it's amazing. You're glowing. You do not.
And also the laxity is really good. Like, so when I saw her, I was just starting to feel just that area get a little bit loose. And she said, no, that's going to be fantastic. You're going to get a great result from taking the hormones.
Yes.
But then there was the conversation of what hormones, because again, there's all this talk about biomimicking hormones. There's tablets that are pre-formulated. There's the troche, there's the cream, there's the gel. And doctors sit in very different ends of the spectrum as to what is the right thing to do.
So I guess, firstly, the important thing for you to know, and for all patients to know, is if you're taking estrogen and you have a uterus, you have to have progesterone as well. And the reason for that is that unopposed estrogen can cause endometrial hyperplasia or thickening, which can cause precancerous changes in the endometrial lining, so increased risk of endometrial cancer. So it's really important for you to understand that. Now, the progesterone component can be anything from a Mirena or progesterone tablets, progesterone creams. But yes, as you said, there are a myriad of options. So I think you actually do need to choose an expert, even if it's just as you do for that particular part of your health management, because some of my colleagues that I work with are very old-fashioned and would never advocate for any of the stuff that I do. So you do need to find the right person for you, and a person who does take it upon themselves to educate themselves and read extra journal articles and order tests that are not Medicare rebatable, that are private tests, but that will add to the picture that you're able to interpret with your patient.
How often can you use it? Is it safe to use? Because there's a lot of confusion about, I mean, I've read a lot, I've listened to a lot, I've watched a lot on the benefits of using vaginal estrogen, but then how often is too often?
No. So look, you need to use it every night for 2 weeks to really get the mucosa nice and plump and much more moisturized, and turning over nice and quickly as it should be. Potentially, I guess you only do use the pessaries twice a week, and it would be a bit of trial and error, really. I don't see, as I said, it's very minimally systemically absorbed. So I wouldn't have thought that it would cause excess estrogen, but if you did notice sore breasts or bloating or anything like that, then you would perhaps cut down on the use. As you rightly question, using systemic hormone replacement therapy, so either in a topical gel or patch or troche or tablets, does estrogenize the vagina as well. But sometimes adding a little bit of topical,
The local
is quite helpful.
Now, going back to what you raised, which is a super interesting topic of its own, which is the brain fog, the memory, the cognitive sharpness, that I think there are 2 times in your life where you really are just confounded by that loss. And one is after childbirth, like when you're in the haze. I just remember wanting my brain back. Just all I prayed for was, I want my brain to return to me. And then in menopause, so I didn't know I was in menopause, but I do definitely remember my brain was mush at that point. Can we regain it?
Absolutely. It's a transient thing, as you do postpartum. You have a period whereby your estrogen levels are through the roof and then plummeting, and your brain receptors are a bit confused as to what's happening, and they're not working as effectively, and you've got prolactin from your breast milk and all of that kind of thing. So exactly the same in the postmenopausal or menopausal period. The hormones are all over the place, and they are an integral part of neurological functioning. And so they will go off for a little bit. And look, to be honest, with or without hormone replacement therapy, it definitely does return to normal after a time. But menopause hormone therapy has, there's lots of studies which talk about brain function and reducing dementia, delaying the onset of the atrophic changes in the brain that are normal with aging. So there's definitely very good evidence for that. Look, and it's not here yet. Certainly the discussions have been had with our compounding pharmacists, and we are, that will be explored. But essentially all the trials show after the onset of menopause, increase in number and depth of wrinkles, increased skin laxity, reduced skin hydration, loss of elastin. We know that the skin cells don't turn over as quickly as your metabolism declines postmenopausally. And that's how, obviously, the Secret skincare, which is my skincare brand, targets or increases the rate of turnover of skin cells to get those beautiful plump baby cells to the surface. So with menopause, the skin turnover is much reduced. You get dullness, as I said, loss of elasticity, wrinkles. So using systemic hormone replacement therapy, as evidenced by your amazing, beautiful, glowing skin, has a huge effect on the skin itself, on your whole body. But I definitely think in the future,
I would say on the whole body, and that's something I do want to actually. The skin on my body is better.
Yeah, absolutely. Women start to get those crinkly arms.
I don't have any of that. I mean, I'm super sun safe, and always have been, but I did notice an improvement once I started that generally the skin of my body was improved.
Increased tone, increased firmness, and that all the layers of the skin are improved. It's not just the topical, the layer that we see. It's the layers beneath it that are turning over and rejuvenating much more quickly when we're on hormone replacement therapy.